Welcome back to our channel. Today we're tackling an essential topic for those of you still in the workforce past the age of 65, navigating Medicare. Many individuals working past 65 face unique challenges when it comes to Medicare. Let's break down the most common mistakes. 1. Missing enrollment deadlines. The initial enrollment period starts 3 months before you turn 65, includes your birthday month, and ends 3 months after. Missing this window means you might face a 10% penalty on your Part B premiums for each year you delay enrollment. Real-life example. Consider Jane, who turned 65 while still employed. She assumed her employer coverage was sufficient and didn't sign up for Medicare Part B. When she retired at 67, she faced a 20% penalty on her Part B premiums, resulting in higher costs for her healthcare coverage. 2. Misunderstanding employer coverage. If you work for a company with fewer than 20 employees, Medicare becomes your primary insurance when you turn 65. Failing to enroll in Medicare Parts A and B can leave you with significant out-of-pocket costs. Real-life example. John worked for a small company and didn't enroll in Medicare because he thought his employer coverage would be enough. After a major surgery, he discovered that Medicare should have been his primary insurance, leaving him with unexpected bills. Choosing the wrong coverage options can be a costly mistake. Medicare Advantage plans can offer additional benefits, but they often have network restrictions. If you travel frequently or live in multiple states throughout the year, you might find that your coverage doesn't extend to all locations. For example, Sarah chose a Medicare Advantage plan that didn't cover out-of-state care. During her winter stay in Florida, she needed medical attention and had to pay out of pocket because her plan only covered in-network providers in her home state. Now here's the most critical Medicare mistake to avoid: not understanding the coordination of benefits between Medicare and employer coverage. If your employer has 20 or more employees, your employer's insurance is primary, and Medicare is secondary. If your employer has fewer than 20 employees, Medicare is primary, and your employer's insurance is secondary. Failing to understand this can lead to gaps in coverage and unexpected out-of-pocket costs. Make sure you know whether your employer coverage is primary or secondary to Medicare, and adjust your enrollment accordingly. To summarize, avoiding these Medicare mistakes is crucial for anyone working past the age of 65. Remember to enroll in Medicare on time, understand how your employer coverage interacts with Medicare, and choose the right coverage options based on your needs. Being informed and proactive about your Medicare decisions can save you from costly penalties and ensure you have the healthcare coverage you need. Let's go deeper into the specifics of each challenge and provide some actionable tips to help you navigate this important transition. More on missing enrollment deadlines. The initial enrollment period, or IEP, is your first chance to sign up for Medicare. Missing it can lead to significant penalties. For example, if you delay enrolling in Part B and don't have creditable coverage, you could face a 10% penalty for each 12-month period you were eligible but didn't enroll. Special Enrollment Period, or SEP. If you or your spouse are still working and have group health plan coverage, you may qualify for an SEP to enroll in Part B. This period lasts for 8 months after employment ends or coverage ends, whichever comes first. Continuous coverage. Ensure continuous coverage by enrolling in Medicare Part A and B during your SEP to avoid penalties and gaps in coverage. More on misunderstanding employer coverage. Primary versus secondary coverage. Understanding whether Medicare or your employer's plan is primary is essential. If your employer has fewer than 20 employees, Medicare is primary. If you fail to enroll in Medicare in this situation, you could end up paying much more out of pocket. Coordination of benefits. Make sure to discuss with your HR department or benefits administrator how your employer coverage coordinates with Medicare. They can provide you with the necessary information to make informed decisions. Impact on HSA contributions. If you're contributing to a health savings account or HSA, Note that you cannot continue contributing once you enroll in Medicare Part A or B. Plan accordingly to maximize your HSA benefits before enrolling. More on choosing the right coverage options. Medicare Advantage versus Medigap. Medicare Advantage plans offer additional benefits and can be cost-effective, but they come with network restrictions. Medigap policies, also known as Medicare Supplement Insurance, generally offer more flexibility but can have higher premiums. Travel considerations. If you spend significant time in different states or travel frequently, consider a Medigap plan. Plans like Plan G or Plan N provide nationwide coverage and can be more suitable for travelers. Prescription drug coverage. Ensure you have adequate prescription drug coverage. Whether through a Medicare Advantage plan or a standalone Part D plan, make sure it covers your medications at a cost that fits your budget. Real-life example. Jane's story. Jane, who delayed Part B enrollment while working past 65, faced a 20% penalty upon retirement. This increased her Part B premium by $30 per month, totaling an additional $360 per year. Over the next 20 years, Jane will pay an extra $7,200 in premiums due to the penalty. Tip: always verify with Medicare or a trusted advisor whether you need to enroll in Part B based on your employment status and health coverage. Real-life example. John's story. John, who worked for a small company and didn't realize Medicare should be his primary insurance, ended up with unexpected medical bills. After his surgery, he had to pay $5,000 out of pocket because his employer's insurance only covered secondary expenses. Tip: ensure you understand the primary and secondary payer rules. Contact Medicare or consult with your benefits administrator to clarify your coverage responsibilities. Real-life example. Sarah's story. Sarah, who selected a Medicare Advantage plan with network restrictions, faced high out-of-pocket costs during her winter stay in Florida. She had to pay $2,500 for out-of-network services. Tip: when choosing a Medicare Advantage plan, consider your travel habits and ensure the plan offers coverage in all the areas you frequent. The importance of professional advice cannot be overstated. Navigating Medicare can be complex, especially when you're balancing it with employer coverage. Consulting with a Medicare specialist can provide personalized advice tailored to your specific situation. Utilize resources available on Medicare.gov, including the Plan Finder tool, to compare plans and coverage options based on your healthcare needs and budget. Proactive planning is essential. Conduct an annual review of your Medicare and employer coverage to ensure it still meets your needs. Healthcare needs and coverage options can change, so staying proactive helps avoid surprises. Keep all documentation related to your healthcare coverage, including communications with your employer and Medicare, to ensure you have a record of your decisions and coverage status. By understanding the intricacies of Medicare and how it interacts with employer coverage, you can avoid costly mistakes and ensure you have the healthcare coverage you need as you continue working past 65. Remember, being informed and proactive is the key to making the best decisions for your health and financial well-being. By understanding the intricacies of Medicare and how it interacts with employer coverage, you can avoid costly mistakes and ensure you have the healthcare coverage you need as you continue working past 65. Remember, being informed and proactive is the key to making the best decisions for your health and financial well-being. To summarize, avoiding these Medicare mistakes is crucial for anyone working past the age of 65. Remember to enroll in Medicare on time. Understand how your employer coverage interacts with Medicare. Choose the right coverage options based on your needs. Being informed and proactive about your Medicare decisions can save you from costly penalties and ensure you have the healthcare coverage you need. If you found this video helpful, please share your Medicare experiences in the comments below. Don't forget to watch our other videos for more valuable insights on retirement planning and healthcare coverage. And of course, subscribe to our channel for future updates. Thanks for watching.